So one of the things that really maintains insomnia and is a common characteristic of people with insomnia is this anxiety about sleep. And we can almost think of it as like a phobia of not being able to sleep and the consequences of what it would mean to have a poor night's rest. And in this video, I'm going to talk about some of the strategies that you can engage in, some coping statements that I think can be really helpful to target the sleep anxiety to make sure that you feel much more competent and confident in your ability to maintain your sleep and to do well in your everyday. Hi, if you're new here, my name is Dr. Parky. I'm a behavioral sleep medicine specialist, and I did my postdoctoral fellowship at Stanford's Sleep Health and Insomnia program. I treated lots of patients with chronic insomnia. I've also written a book. So hopefully I have a little bit of information to be able to share with you to help beat your insomnia just a little bit more. So the first thing that's helpful to know is that not everybody needs 8 hours worth of sleep. So some people have this idea in their mind that because I'm not getting my 8 hours, because I'm struggling with insomnia, that something terrible is going to happen. And one thing that's helpful to recognize is not everybody needs 8 hours worth of sleep. Perhaps you're somebody who can function on 7 hours or maybe even 6 hours worth of sleep. And at the very least, thinking that you need 8 hours when you're not getting that much is only going to exacerbate your anxiety. It's not a particularly helpful thought. So first of all, just recognizing that everybody has different sleep needs. Through treatment and cognitive behavioral therapy, you'll know what your sleep need is, but you don't have to start by assuming I need 8 and I'm only getting 6, and this sort of 2 hour of disparity is causing me even more and more distress, which is actually going to be reducing my sort of sleep pressure, or at least in the sense of this hyperarousal masking my sleep. So not a particularly helpful thought. Recognize that you don't necessarily need 8 hours, and that can be one way to reduce some of the anxiety about sort of expectations or biases about sleep needs. A second coping statement that's based off sleep science is that a lot of the deep sleep happens in the first half of the night. So a lot of people worry that because I woke up after 4 hours and the rest of my sleep was really kind of light, what if that really impacts my next day? And all of those things, of course, again, engender anxiety. But one thing that I want to really highlight is that this is kind of actually a normal occurrence. The reason why it's so hard to kind of fall back asleep compared to falling asleep in the beginning of the night is because we have less sleep pressure that has been mostly utilized in the first half of the night. And the first half of the night is usually where all that deep restorative sleep happens in the first place. So in the future, we'll talk about some strategies to make sure you're getting more consolidated sleep, but don't worry as much as you need when it comes to not getting that sort of super high quality sleep in the second half of the night. That is completely normal because our body has already used up a lot of the sleep that it needs to restore itself, that sort of deep sleep, slow wave sleep, as you might put it. So a third coping statement, which is kind of related to what we were talking about functioning during the day, is that there's actually been a lot of studies that have looked at the sort of relationship between insomnia and performance. And one of the really interesting things that people have found is that when it comes to insomnia versus sleep deprivation, there's actually a difference between the two. That yes, when it comes to sleep deprivation, when you're not getting enough sleep and you're willingly waiting until 2 a.m. because you're playing video games, but you have to wake up at 7 for school or work, that's going to cause a lot of problems in the context of medical issues and consequences related to functioning. But when it comes to people with insomnia, their efforts and functionality is actually pretty good. Like everything feels a little bit more effortful, but their actual deficits and compared to good sleeper counterparts is actually quite minimal. And the reason for that is this sort of idea of hyperarousal. So people with insomnia are constantly in this sort of fight or flight response. And this is part of the reason why they have insomnia. And it's a bit of troubling in that regard. But in terms of competence, the arousal levels actually override their sense of sleepiness, which then allows for better functioning. So surprisingly, things are a lot more effortful, but performance remains relatively intact. And to bring the science into practice, one of the things that I've noticed with my patient is that yes, like things are a lot more effortful. I can hear the distress in their voice and I can see them for who they really are, which is this very resilient, successful person. Like in a lot of ways, if you've been struggling for insomnia for years, you are an expert at dealing with insomnia because I suspect you're doing pretty darn well for, all things considered. You're probably doing well in your job, maybe in your family and your relationships, or just who you are as a person, that you are actually quite resilient in spite of your sleep problems. So that can be one thing that can be really helpful, especially as you're engaging in CBT or other strategies to kind of recognize, yeah, like I'm pretty good at dealing with sleep problems and I can certainly be willing to give up some, good sleep for a few days in favor of, let's say, following these strategies to be able to get rid of my sleep problems for good. And the last coping statement that I think can be really powerful is that you are looking for support. Like the fact that you're watching this video suggests that you are taking the step towards figuring out how do I make sure that my insomnia doesn't stay long term so that it doesn't affect my quality of life and make sure that I can get and return back into being a good sleeper. So if you're interested in watching more, feel free to check out some of the other videos, check out the book. I'll put it in the link in the description below. I'll also provide an insomnia guide if you just want to type insomnia in the comment section. I'm happy to give you that guide free of charge. Otherwise, take good care for now. Bye bye.